video, we shall discuss disorders of the kidney. Two disorders of the kidney that you must know very well are kidney failure and kidney stones. So what is kidney failure? Well, kidney failure refers to the malfunctioning of the kidneys as a result of partial or complete damage of the nephrons. What causes kidney failure? Kidney failure is caused by accidents or injuries to the kidney, infections, poisoning, and as well as drug abuse. So how can kidney failure be treated? The first treatment is by having a kidney transplant. A kidney transplant is the surgical transplant of a damaged kidney from a donor to a recipient. The disadvantage of a kidney transplant is that it's painful and the surgical procedure causes discomfort. Also, there is a risk of tissue rejection. And lastly, kidney transplants cause the immune system to be weak. Lastly, sometimes a kidney transplant has side effects and makes the patient need frequent medical checkups. The advantages of a kidney transplant are that it improves the quality of life and reduces risk of death from kidney failure. Also, the patient doesn't need long hours of dialysis treatment. The second treatment of kidney failure is by using a dialysis machine, which is also called a kidney machine. A kidney machine is made up of a thin coiled tube through which a patient's blood passes. The tube is long and coiled in order to increase the surface area for diffusion. The tube is selectively permeable to allow small molecules such as urea and salts to diffuse out of the blood into the dialysis fluid. The dialysis machine contains dialysis fluid which has salts and glucose in water. The salts and glucose have equal concentration to that of normal blood to prevent glucose and important salts from diffusing out of the patient's blood. The patient's blood is drawn from a vein on the patient's arm and taken into the dialysis machine through a tube with the help of a pump. After passing through the machine, the blood is returned to a different point on the same vein. Why do we choose to connect to a vein? Well, it's because veins contain a lot of wastes and carry blood at a lower pressure, allowing more time for diffusion of the waste to occur. The advantages of using a dialysis machine are that there is no risk of tissue rejection, and also there are no side effects. On the other hand, the disadvantage of using a dialysis machine are that a patient has to spend long hours on a dialysis machine for their blood to be fully purified. Secondly, the machine is expensive and it is not readily accessible. Lastly, the patient's diet is restricted. The patient is advised to reduce intake of proteins. This is because proteins, when digested, produce end products, amino acid, and those amino acids, if in excess, they are deaminated to form urea, which is a waste that is removed by the machine. Well, I hope you've learned the disorders of the kidney and their possible treatments.